Hey, good morning, everyone. Dr. Tam here. As I am out in nature today, I like to go over with you what is lower back pain, when is it the most severe, and also how are you supposed to take great care of your health? A lot of people seems to tell me that very, it's a lot of work, to take care of your body. It's a lot of work to take care of your health, and I think you're right. I agree with you. With all the advertisements of unhealthy foods, drugs, and pharmaceuticals out there that where it gives us the notion that we can just take a pill for everything. It's not easy to overcome some of those things and just say, you know what, I'm going to really work at taking great care of the body. So, when you look at lower back pain usually comes from an ache or a sharp stabbing pain, maybe a burning pain in the lower back. To give you some numbers, over 70% of Americans will experience some form of lower back pain in their life. Lower back pain is also the number one, not number two, not number three, the number one musculoskeletal problem that people go to the doctors for. It costs America billions of dollars every single year because people have to miss work due to their lower back problems, and is becoming more and more prevalent. Now, why is that? Here's the key. As we are having more time sitting in the car, sitting at a desk, not moving around, being sedentary, you have more shows like Netflix, movies, just all kinds of cartoons that consumes our life. Now social media, people are spending time looking down at their phones, they're spending more time in the toilets and bathrooms, right? I was in a public restroom and a gentleman was using the bathroom while using his phone at the same time. So when you look at that, how much does it actually consume our life? And is it becoming harder and harder to be healthy and to prevent lower back problems? I believe it is, and you have to work harder at it now than you ever had to before. So when does lower back pain is in need of help? So let's talk about the most serious help. When do you have to go to the emergency room because you have lower back pain? Here's the number one thing. If you all of a sudden feel a sharp pain, and then right afterwards you feel weakness in your legs, chances are it's compressing the spinal cord or a severe pinched nerve. That's one of the things that you might need to seek out emergency help. Second, you all of a sudden start losing urinary control and bowel control. All right. So you can't control your urine, you can't control the way you eliminate. That is a problem. All right. The next one is weakness without pain. So let's just say, or weakness with numbness, I should say, where you don't feel the pain, but all of a sudden your legs collapse on you. All right. That is a sign that you need to seek special help, emergency room help. If you have chronic lower back pain, and all of a sudden, you started losing massive amounts of weight, right? That's another sign that you need to seek emergency help. I mean, there's a few things that you just have to know, and those are it when lower back becomes an emergency problem. Now, when does lower back pain become how I should say it, more of a problem, but a problem that is not emergency, but you absolutely need to seek help? That is when you consistently get lower back pain in 1 year more often than once a month. If you're getting lower back pain more than once a month, chances are it's affecting you to the point where it's affected your life, right? A lot of people get lower back pain in our office by the time they come to our office, where they get it 2 times a month, then it becomes 3 times a month. But every time it hits them, it's a pain that kills them for a day or two. So they're losing out on family time, they're losing out on time from work. if you notice that you are not going to family functions because of your lower back, you're having to miss your kids' games, you're having to maybe have someone else do the shopping for you, you're not able to go on trips anymore, it's affected your relationship, your intimacy, this is a time to really seek help. If it's affected your life in any shape, form of way, you got to seek help, right? Now, I don't mean the lower back soreness that you get from exercises or walking and working out. I mean, it's one of those consistent lower back problems that you're getting every month or bi-weekly, every 2 weeks or every other week, right? Or every week. If it's affected you that way, chances are you're going to need some professional help, right? Now, then you might ask, well, how do I know who to go to? Here's the thing. Number one, when you go to someone, whether it's your medical doctor, whether it's a chiropractor, a physical therapist, acupuncture, make sure you really sit down and listen to you. The worst thing that I hear is, I went to the doctors, Dr. Tam, went to a specialist, and they never listened, right? So you have to make sure they're listening to your problems and come up with a solution that is best for you, and you know exactly why. See, one of the best things that I do, well, not the best things, I should say, one of the key things that I do when I sit down with the patient for a report, I tell them this. I said, my goal is that you walk out of here today understanding exactly what is going on with you, all right, and why you need the treatments that we are recommending. The worst thing for us, here's the worst thing, is you walk out, husband and wife walks out, looks at each other and says, I have no clue what he just said. Do you understand what he said? Nope, I don't. That's the worst, okay, is that you do not have an understanding of your problem is the worst thing. So make sure that you walk out of any office understanding exactly what your problem is. And that it makes sense, right? I mean, I've had patients that tell me they've had lower back problems. They go to the doctor, and then the doctor tells them that their lower back problem is because of their diabetes, or if it's because, only because they're overweight. And it's like every other day, right? Someone walks in and says, hey, Dr. Tam, my doctor told me that my lower back pain is because I'm overweight. I said, really? Yeah, you're overweight, but, that's what they said, that it's caused due to your weight? They said, yes, it's due to my weight. They said, and I asked them, I said, did they ever do any diagnostics? Did they ever do an exam? Take x-rays and whatnot? And they said, no, they didn't. And we take an x-ray, and their spine is not only degenerated, but there's a curvature in there, right? But it's not every bone. See, that's the misconception. People think that just because they have degeneration, and doctors call it degeneration, and then they say it's arthritis and it's due to their age. See, in my book, The Truth About Chronic Pain, I talk about how it's not due to your age, right? It's not due to your age. See, there's other bones in your spine that is the same age. I promise you, it's the same age that do not have the arthritis or degeneration. But why is it that 2 to 3 of them do and the rest of the 21 does not, right? So you got to ask your doctor that. Hey, doc, here's the question that you ask him. If you believe that my arthritis is due to age, why is it that there's only 2 or 3 of them that are really bad and the rest are perfectly fine and looks as if I was 20 to 30 years old again? Okay. You got to ask him that, right? So, I mean, that is if you're like 50, 60, you got to ask them that question. Oh, it's due to your age. It's not due to age, okay? There is some normal wear and tear, but it's like a car. If you take your car and one of your front tires went out of alignment 20,000 miles ago, you bring it to the alignment shop, and they said your shocks, your struts, your brakes on that side, and your tire is completely shot. And they tell you, oh, but it's due to the age of your car. It's been 20,000 miles. But your other 3 tires are completely fine. Is that really due to age? I don't think so. Okay. So, when you are looking at lower back problems in general, disc problems, could it be sciatica? How do you differentiate between sciatica and lower back problems? I'll tell you how. Sciatica starts off in the pelvis, all right? And it runs down the back of your leg. Just the back of your leg is the sciatic nerve, and it runs all the way down to the bottom of your foot. If it's coming from the lower back or the pelvis and it wraps around the front of your leg, even the front of your knee or the front of your lower leg, and goes to the top of your foot or the front of your upper leg into the groin area, any of those, that is coming from your lower back. Okay, I want to differentiate that. So most people don't know how to differentiate that. Most doctors sometimes are confused on how to differentiate that, and they have to send you to a neurologist, right? So you end up going to multiple specialists and still not getting an answer. And what a lot of our patients are getting is a pill. They're getting a pill. They're getting physical therapy. They're getting shots, right? Toradol shots, cortisone shots. Sometimes they said, hey, you have an infection somewhere, and they got an antibiotic shot, right? And when those don't work, what's next? Surgery, right? So that's my 2 cents on lower back problems, on why you need to that's how you know what it is and why you need to take better care of yourself overall, right? So going back to being healthy, with all the TV advertisements and everything that's out there, you have to work a little bit harder. I'm sorry, you do. You just have to work a little bit harder. There's too much temptations, a lot of marketing dollars put into place to really wheel us into having a fourth meal, right? Into having foods that are not going to be the best for us. You have MSG in foods that are going to be exciting our brain to want more, to get us addicted. MSG is addictive. Sugar is addictive. There was a mice study done, just so you guys know, that they saw there were the mice was more addicted to sugar than they were cocaine. Okay, so that gives you an idea of how addictive sugar is. So you have to fight it. You have to fight it a little bit. But here's the thing. You have to fight it with good intentions, strong enough conviction to know that this is what you need to do, right? My grandmother had diabetes on my father's side. And I would say for my dad's side, I did not come with good genes. My grandmother had diabetes, had neuropathy, ended up in a wheelchair the last few years of her life, and eventually had part of her foot amputated. My father also, after coming to the US, was not used to all this amazing food that was available, that wasn't available in China at the time. And he ate a lot. He wasn't very healthy. And eventually, whether it's one thing or another, it led him to have lymphoma, So, he had cancer, and within less than 12 months, he passed away. So my genes are not going to be the best, and I know that. So knowing that, I have to take phenomenal care of my body, right? On my father's side as well, 2 of my aunts have diabetes. I believe they're also overweight. On my mom's side, you've got different problems and issues as well. I mean, we all have that nowadays, right, in our family. But it's what we do and our lifestyle changes that we make that really determines how well we do. That's why when patients come in, I ask them, I say, hey, you drank enough water today, right? Did you do your exercises? Have you done your stretches? I'm doing it as a doctor, but I also do it as a human being because I care about your health, right? Not just because of your lower back, but your health overall. I know that if you are healthier, right, you're going to show that, to your children, to your grandchildren, that you can be healthier and that they can be healthier. It affects definitely a lot of generations to come. I mean, really be a role model for your kids, for your grandkids, and let them know that yes, you may have to work a little bit harder on your health, but in the long run, you educate them and let them know that it's worth it. All right. Until next time, this is me. I don't want to ramble on too much, but ultimately, I want you to get the point. I want to get the point across to why you need to take great care of your body, how to know when you need to seek help for lower back problems, because it's definitely one of those things that bothers a lot of people in this world. Have a great day.